Good evening, everybody. We'll start with today's session of Organ of Medicine. We are discussing since long time the repetition of the potency and potency selection part in the organ of medicine as described by Dr. Samuel Hahnemann. Certain rules and regulations which are necessary to understand, and there is always a problem, a question, a dilemma happens to be there regarding the potency. And those aspects are thoroughly explained by Dr. Samuel Hahnemann on this sixth edition of Organ of Medicine, right from Aphorism number 275 onwards. And we have discussed few rules which we have repeated again and again, which are necessary to be kept in our mind. First important rule is that if the susceptibility is high, potency should be high, repetition is less. Second important rule is that if the susceptibility is low, potency is low, repetition till the susceptibility gets aroused. Number three, where exactly the cure is expected. That is the site of pathology. What pathology it is, that is another point which you have to take into consideration. Then how much is the simillimum? That also you have to take into consideration. Higher the simillimum, higher the potency, less the repetition. Then it also depends upon the what medicine you are going to prescribe. Because medicine is one more important point on which you have to take into consideration the potency selection. Because certain remedies have a very high, very smart action even in crude forms, and which are not needed to give it in high potency. They works even in low potency also strongly. So which medicine you are going to take into consideration for the patient, that is also one point which we have to look after. And then what type of disease it is. If it is acute, then you have to think about the potency. If it is chronic, you have to think about potency. In acutes, yes, definitely the high potency is needed because susceptibility is generally high and we get a clear-cut totality, but less repetition, because just one stimulus is sufficient. If you go on repeating, the homeopathic aggravation is immediately bound to happen over there. In chronic case, he explains, here the susceptibility as comparatively generally low, and as it is low, then you have to start with low potency, just above the what natural disease or from the patient, and then gradually you have to go on ascending till the original symptoms of the disease happens to be there. And at that time, when it happens to be there, this is the time you have to wait, you have to make a break, and you have to stop. Wait for 8 days, 10 days, 15 days, and just see what happens. If the patient symptoms disappears completely, there is no need to repeat the medicine. It is the time to stop the medicine. If the patient's symptoms remain still, after 15 days, if it remains, then there is definitely a need to give potency in higher medicine in a higher potency. All those things which we have discussed regarding the potency selection. And last point which he has discussed, there are more susceptible patients are always there with you, and unsusceptible patients are very less. The ratio which Hahnemann have explained, it is how 1000 to 1. 1000 susceptible patients are there, only one unsusceptible patient is there. And that's why you should be cautious when you are prescribing the remedy. So all those points which we have discussed up till now, let us go ahead with the next aphorism. And this aphorism, in fact, is the most important aphorism, where he also explains exactly the role of ascending potency. So we'll start with this aphorism number 282. There is one big footnote to this paragraph. We'll finish that also. Aphorism 282. It would be certain sign that the doses were altogether too large if during treatment, especially in chronic disease, the first dose should bring forth a so-called homeopathic aggravation. That is, a marked increase of the original morbid symptoms discovered, And in the same way, every repeated dose, however, modified somewhat by shaking before administration, that is more highly dynamic. So what he explains that if in the chronic case, actually he has mentioned that you should not go directly with high in chronic cases. It is always better to start with low and gradually ascend. But if you would have given first dose itself high, and that is so strong that it has produced the aggravation, then you should be cautious. Don't go too high. You just wait, and sometimes if you feel that remedy is perfect, you modify it in further administration. And that which he has explained while explaining the aphorism number 247. There is big footnote written this paragraph, and this footnote is completely new in the sixth edition, which was not there in earlier. And this footnote, he has mentioned many things. So what he wants to explain, this is wholly new regarding the repetition in miasmatic diseases as well as local treatment in the chronic diseases, especially in psychosis. Earlier in the fifth edition, he has mentioned no local treatment should be advocated. This is the most important point which he has mentioned. But in this sixth edition, while explaining the psychosis, he advocates the local treatment. But that he has explained with the caution. So we have to understand exactly what Hahnemann wants to explain regarding the local application and even repetition of the dose. So this footnote is wholly new in the sixth edition. Footnote number 163. The rule to commence the homeopathic treatment of chronic diseases with smallest possible doses and only gradually to augment. Augment म्हणजे वाढवणे, to increase. Augment means only gradually to augment them in subject to a notable exception in the treatment of three great miasms, while they still efflores म्हणजे to come out, उमलणं, बहरणं, to come out, while they still efflores on the skin that is recently erupted each, the untouched chancre on the sexual organs, labia, mouth, lips, or so forth, and the fig words. So in case of Sora, it is each in the form of vesicles. In case of syphilis, it is primary chancre, a single painless hard ulcer either on male or female genitalia, or even in lips also, mouth also, this can happen. And third, in psychosis, it is the fig words. These are primary manifestations of all three miasms. Sora is each, psychosis is fig words, syphilis is primary chancre, a single painless hard ulcer. These not only tolerate, but indeed require from the very beginning large doses of their specific remedies of ever higher and higher degree of dynamization daily, possibly also several times daily. So what he said, these disorders which primarily appears on the skin requires large doses. Large doses means here he tries to explain large doses means quantity wise large. So here you have to start with low potency and gradually increasing the potency, repeating it till it disappears. These are the things which will not disappear immediately with a single dose. It will not disappear so fast. The pigworts will not go immediately with first dose. The primary chancre will not vanish with the first dose. It requires little bit repetition because susceptibility generally low in such cases. And if it is chronic one, it definitely requires in chronic one, it definitely requires to start with the low and gradually go on increasing. If this course be pursued, there is no danger to be feared, as is the case in the treatment of diseases hidden within. That the excessive dose, while it extinguishes the disease, initiates and by continued usage possibly produces a chronic medicinal disease. So what he said, if this course be pursued, if you continued it, there is no danger in fear To be feared, as is the case in the treatment of diseases hidden within, that the excessive dose, while it extinguishes the disease, initiates and by continued usage possibly produces chronic medicinal disease. During external manifestation of these three miasms, this is not the case. For from the daily progress of their treatment, it can be observed and judged to what degree the large dose withdraws the sensation of the disease from the vital principle day by day. For none of these three can be cured without giving physicians the conviction through their disappearances that there is no longer any further need to treat these medicines. So if you are treating a psychosis or if you are treating a syphilis and you, for example, you have selected a Merksol for the case, you have started in LM potency. You are repeating that depending upon his susceptibility and all, you have selected LM5, for example, and you have started LM5. You are continuing it, daily repeating it, and you are observing the progress. Patient comes after 15 days and he says that, yes, little bit better, but still the ulcer is persistent. Now you have changed, you have gone to LM6. Again, you are asked him to repeat. You have to tell the patient, if you feel that it is disappeared completely, meet me. If after LM6, if it still persists and comes patient after 15 days, then it means that still it is not producing exactly the desired result, even though the patient is improving generally. Then you have to go little bit again higher potency. For example, you have to go for LM7. And then after starting LM7, after 2 to 3 days, it totally vanishes. So it takes a long time. It is not within a day, it will disappear like a acute disease. It's a long, tedious process. And when this disappears, then you have to ask the patient to stop the medicine. That advice you have to give. If it disappears completely, just stop the medicine. Don't repeat it thereafter. So same is true when you are treating the psychosis, when same is true when you are treating the syphilis, same is true when you are treating the SORA. All three miasms, if primary manifestations are there, you have to go with this ascending line of treatment and the medicine should be given internally. He is very clear regarding all those things. Now let us go ahead what he says in next paragraph. Since diseases in general are but dynamic attacks upon the life principle and nothing material, no materia pecans, as their basis, as the old school in its delusions has fabulated. Fabulated म्हणजे खोटं सांगणं, to tell lie. As the old school in its delusion has fabulated for 1,000 years and treated the sick accordingly to their ruin, there is also in these cases nothing material to take away, nothing to smear away, to burn or to tie or cut away without making the patient endlessly sicker and more incurable. Chronic diseases part 1. Than he was before. Local treatment of these three miasms was instituted. In old school, they used to consider this disease as a local disease. So if each is there, they consider it is a local disease. If primary chancre is there, they consider it is a local disease. If figworts are there, they consider it's a local disease. And if you consider your concept is wrong, then accordingly your treatment logically is that to remove that from that place. So if each is there, you ask the patient to apply some local ointments. If the warts are there, you ask them to remove them by cautery, either with the electric cautery or caustic cautery. If primary chancre is there, they used to do cautery or they used to apply mercurial preparation. And this was what done by old school since long time. And they have suppressed the primary symptoms of all three miasm and which converted into the secondary symptoms of the miasm. The SORA, the syphilis, the psychosis, which was superficial on the less important organ, turned inside. Then the patient developed a big disorders. The big disorders like pathologies which happens to be there in the brain, in the lungs, in the liver, in the kidneys, in the GI flora, in the nervous system, all those things happen because you have removed primary symptoms by the local means, and this was advocated in allopathy. Anyone says this is not the case with homeopathy because cause is not local one. Cause is internal, cause is dynamic, and that kind dynamic cause which has affected the vital force reflected in the expression of it in the forms of vesicles, in the sora, in the form of primary chancre or ulcer in the syphilis, in the form of warts in case of psychosis. And these are manifestations which are superficial enough. Don't do that thing. That is what he has advocated, even in chronic diseases, volume 1, the part 1. The dynamic inimical principle exerting its influence upon the vital energy is the essence of these external signs of the inner malignant miasms that can be extinguished solely by the action of homeopathic medicine upon the vital principle, which affect it in a similar but stronger manner. Thus, extract the sensation of internal and external spirit like conceptual disease enemy in such a way that it no longer exists for the life principle, for the organism, and thus releases the patient of his illness and he is cured. So if these three types of patients comes to either a syphilis primary chancre, either a psychosis with pigwarts or gonorrhea, or in case of psora, it is a vesicular itch. Your treatment should be aimed at internal. You have to treat that individual because his dynamics are deranged, because of which they are expressed on external surface. If you treat the internal dynamics, it automatically will going to diminish. And this is too important to know. If we do the same mistake as done by the allopathic or old school, will again do the same thing, will suppress the primary manifestations of the disease, will convert that disease from less important organ to more important organ, and then internal secondary symptoms of psora or psychosis or syphilis will develop. And these are very difficult to cure and these are very harmful for the human. So whatever may be the chronic disease, whether it is psoriasis, whether it is psychosis, whether it is syphilis, your treatment solely should be aimed at the center, that is internal homeopathic medicine should be utilized. And then to conclude that footnote, he explains one important thing, which is the addition which was not there in earlier edition. Experience, however, teaches that the each plus its external manifestation, as well as chancre, together with the inner venereal miasm, can and must be cured only by means of specific medicines taken internally. So if there is psora, manifestation of psora in the form of itch or vesicular eruption is there, or if there is a syphilis in the form of primary chancre is there, or if there is a if these two disorders are there, they should be treated compulsorily internally. There is no local treatment is needed or adopted. But he explains one important thing, but is very important. But the pigwarts, underline this, if they have existed for some time without treatment, what he said, but the pigwarts, if they have existed for some time without treatment, have need for their perfect cure, the external application of their specific medicine as well as their internal use at the same time. And this is very important thing which he has explained in this sixth edition of Organ of Medicine, which was not advocated in the fifth edition. Because these pigwarts, if you give the internal medicine, the pigwarts are nothing but the fibrous proliferation. It is the external manifestation in the form of fibrous tissue. When you give internal homeopathic medicines for these pigwarts, the internal disorder may get vanished, but many a times these pigwarts remains. And then Hahnemann explains that if you are treating that patient with the internal medicine, apply same medicine on that wards at the same time, only because these pig warts are not so easily recoverable with the help of internal treatment. And this he has advocated in last edition. In last 10 years, he has changed view regarding the treatment of pig warts only. So only for the psychotic miasm, he was ready to apply the same medicine, which is founded on the basis of law of similars, and same medicine, internal as well as external application. For both purposes, he has advocated over there. And this was a big change in his mind in the last 10 years of his life. So see, for all three miasms, he explains the line of treatment, how to go ahead. For Sora and syphilis, he explains that you have to be very specific only with the internal treatment. The treatment should be advocated in such a way that you go on gradually increasing the doses. So you should not go directly with high potency, but you start with low and gradually ascend. That will be better for the patient so that you will not get immediate homeopathic aggravation. And that is one important point which he has advocated. But last point which he has changed his thought for the treatment of psychosis, because his own experience mattered here. His own experience explained that it was not getting easily recovered with the help of internal treatment only. And then he advocated same medicine internally as well as externally for the psychotic wards you can apply. And that treatment he has mentioned over there. So we have learned a big aphorism along with a big footnote and complete change in the 6th edition of Organ of Medicine regarding his thought of treatment of chronic diseases, specifically with psychotic miasm. So that's all for today. We'll meet directly on Monday. Tomorrow will be the holiday. Tomorrow and Sunday will be the holiday. We'll meet directly on the Monday with the next aphorism. And till that period, you go through the aphorisms again. If any queries are there in your mind, try to ask regarding them so that it will be get completely clear. Any query, if any question is there, we'll have a discussion. Otherwise, we'll conclude today's session.
Good evening, sir.
Good evening. Yes.
Sir, my patient, a case of uterine fibroid with external hemorrhoids. I started with Naxwamica 0/1 and I followed with 0/2, 0/3 and 0/4. During this period, the patient was very much felt like a well-being, sir. Dysmenorrhea reduced, external hemorrhoid with the bleeding piles. It also reduced. Now she is on Naxwamica 0/4, but this month periods she got more flow, and also the external hemorrhoids also what's like when she came to me, the first stage reappears now.
Okay.
It was shrinked and it was well and good for past 4 to 5 months, but last menses she is not felt like she wants to go for surgery. It was on, I thought it was on right way. She is getting cured, but this month she felt like, ma'am, I can I go for surgery? What can I do at this stage, sir?
Basically, yes, Dr. Raji. A most important thing is that you are not taking into consideration the miasmatic focus of the disease. Hemorrhoids are there since long time. Fibroids are there. The miasm is psychotic, psychosyphilitic, or psychotic. Better. If it is psychotic, you are giving Naxwamica, a remedy which is very superficially. Open your
Okay, sir.
Mater Medica. Look the action. It is only for 1 to 7 days. It doesn't have capacity to dissolve the fibroid. It doesn't have capacity to remove the hemorrhoids. Yes, it might remove the state only. Patient might feel palliated. He will not get cured with Naxwamica at all. Not at all. For that patient, you have to find it out a remedy which has that depth, which is psychotic enough or psychosyphilitic, depending upon the miasm of that specific patient. but that much depth should be there. If Nux has relieved, then you have a chance to complement it. Then you might get, she might require a sepia which covers the hemorrhoids as well as the fibroids. Because
Okay.
Nux never have that depth. Problem lies that you are repeating the same remedy. Nux will not going to cure the fibroid or hemorrhoids at all. Yes, patient might feel palliated with the state, but not at all the cure will be there. You have to complement it either with right remedy. If she is sepia is complementary to Daxomica. If she is Kalikab is also complementary. You have to find it out patient's remedy, which is chronic, not acute.
Okay, sir.
That will not going to cure. Naxomica will only palliate. She will not get cured.
Okay, sir. Okay, sir. I understood, sir.
Okay.
Thank you very much.
Yes,
Oh,
Dr.
thank you very much.
Vidya, you have asked one question: how to take case in deaf and dumb women. We'll have that chat because it is a big topic to be discussed. It is not possible to answer your question very easily because I think you have missed the case taking part. You go through the case taking session, that is aphorism number 82 to 90, 104. You might get the answer of this question. If still you never get, I will discuss your question properly. Okay? Because already I have discussed that it is as good as when you take a case of a children, any child or infant. In the similar manner, you have to take the case. Those details already mentioned. If still you have queries, I will definitely discuss. We are 2-3 days are there. You go through those aphorisms 82 to 104. Case taking whole part. Yes, Utpal.
I have a patient, sir, having chronic tonsillitis, pharyngitis, and DNS is also there. Laryngitis, chronic laryngitis also there. Sir, I have given so many medicine, but there is no result. It is patient are not getting relief. Every rainy weather, it has been aggravated, sir. Nose block is also there in rainy weather. What could be the reason, sir? What could be the specific remedy? Can you help?
First important thing is that you have to take detailed case. You have to find it out what is wrong with the patient. Something is wrong. You have to select same thing. You have to select remedy. If it is chronic pharyngitis, chronic tonsillitis is there. The miasmatic focus you have to take into consideration. Generally, these are the tubercular miasm which is in background in such types of cases. If that miasm is strong, you have to treat the miasm. The remedy should have that much of capacity to take care of the miasm. If you remove that, then patient will be cured. If you treat with acute remedies, patient will not get cured. If you use the belladonna or like remedies, which are very short acting, will not going to cover the chronic tonsillitis or chronic pharyngitis. Take into consideration exactly the miasm.
Yes, sir. Actually, allopathy doctor has already advised him to remove the tonsil, tonsillectomy. And for that reason, he is also suffering. He is also in fear. It may turn to cancer like that. So this is another symptom is that cancer, fear of cancer.
But fear of cancer, what is the age of the patient?
Patient is 45, sir.
45. Okay.
Yes.
Have you observed the tonsils?
Pardon, sir?
Have you observed his tonsils by
yes, sir. Yes,
like,
yes, sir.
whether they
Yes,
are
sir.
engorged, whether they are shrunken, whether there are ulcers? What is the picture?
Sometimes, sir, it is inflamed. Sometimes it is size is reduced like that.
But
in every rainy weather, it has been aggravated, sir.
So you better open the repertory, find it out, throat, inflammation, tonsils, and if there is any specific modality aggravated during the rainy damp weather, just find it out. Is there any medicine specifically mentioned for it? Or
yes, sir. It's a so many medicine, 6-7 medicines are there, sir. I have last I have used tuberculin. So I have to wait for this.
Tuberculinum is better remedy as an anti-miasmatic remedy in such types of cases, which solves the
Yes, sir.
problem many a times, and then you have to select again histamine after using tuberculinum.
Okay, sir. Thank you, sir.
Okay. So we'll conclude the meeting today and we'll meet again on Monday. Thanks a lot. Thanks everyone being there. Okay. Yes, Dr. Harne, you want to ask anything?